PIH Engage is a grassroots network of community organizers, specifically in communities across the US, Peru, and Mexico. In the US, we have teams in cities, colleges, universities, as well as high schools. And these teams work in three different pillars: advocacy, fundraising, community building, and education.
Training Institute, or TI, is our annual conference, and it's an opportunity where all of our network leaders from across the country, almost 200 of them, convene together, and we spend a few days learning about one another, designing campaigns for the year, and strategizing about how we want to make an impact in the Right to Health movement over the next 10 months.
My name is Jimena Luque, and I am a part of the Harvard College chapter of PIH Engage. I joined PIH Engage 2 years ago, and I am very, very excited to finally be able to meet leaders from all across the country in person. I think it's just such a fantastic way to remind us of the impact of the work that we do because of not only our numbers, but just like the passion that people have for this type of work. So it's really exciting to be here. I actually learned about PIH Engage because of the work that they do in my home country in Peru. And it's just, I think, very personal to me to see how impactful just where you live and where you come from, like just your geography can impact so much of what is available to you in terms of healthcare, and I just feel like that's so unfair.
I actually grew up in one of PIH's care delivery site countries, Malawi, and it was a wonderful place to live. I highly recommend anyone to go. But the weight of poverty and disease burden is so unnaturally heavy. Like, I had teachers, I had loved ones who are succumbing to diseases, seemingly at the prime of their lives. And as a child, I had to grapple with that really unfortunate and just like devastating circumstance. The equity-focused, justice-focused mission of the organization is what has kept me here and why I continue to volunteer and work full-time now.
Events like the Training Institute are so important for students. In fact, I wish I had the opportunity to attend a Training Institute when I was in medical school. Like trying to bring people to help them get equipped, to give them the skills to organize, and also creating connections between these different students from across the US and even different parts of the world. The role of students is so important when it comes to protecting human rights, because if we don't protect those institutions, they're gonna go away. We're gonna lose that benefits.
If we look at how global health and US health is financed, the US government and governments around the world play a critical role in that. You cannot finance health systems, you cannot confer health as a human right without governments. So Partners in Health's mission of trying to bring care to the most marginalized communities is really reliant on having systems that governments design enable that work. So we target governments to make sure that they know you have to have adequate investment in these systems for organizations like Partners in Health to deliver the quality care that they want. So we really think that it's important that Partners in Health's work, be an example of what happens when we invest critically in global health delivery, but make sure that governments know that they have a role in facilitating that work. We're going to be focusing on two pieces of legislation, one that helps support community health workers in the United States, and the other, which is a resolution in memoriam of PIH's co-founder, Paul Farmer, and his vision for health equity. So we're excited that we're going to be able to advocate for a domestic health policy and global health policy, both of which are grounded in equity and solidarity.
Thank you for confirming the time. A chance for us to meet with our members of Congress to advocate for increased funding for global health and really get the ball rolling for all the campaigns that we're excited for this year.
It's absolutely essential that all these people are organizing and advocating for universal health care, especially now. There's a lot of challenges that we've faced over the last several years, and I'm sure many more that are going to come. Each day, there's more and more urgency for more people to get involved, and the more people we have involved, the more of that power we have. A lot of our opponents have maybe more resources, but we have the people power, and I think we saw that this weekend and today. We had over 100 meetings with members of Congress in a span of 5 hours. That's incredible, right? And that's the power of when people are coming together and organizing. I think especially students and young people growing up in the time that we did, seeing everything that's happening and realizing that we don't want to live like this. We don't want to have to be making these decisions about whether we can afford the medication that's going to keep us alive, or whether we have to work a job just to be able to provide healthcare for our family, or what happens if we lose that job, and kind of living with that day-to-day fear, or not even having a healthcare system that we can engage with.
I think what makes me most excited about Engage is the community that it brings. just being here at Training Institute this year is a testament to that, because our community is huge and it encompasses people from all different types of backgrounds, and it doesn't matter if you're interested in health or policy or education or whatever your background is, there's a place for you here. Engage is not an organization, it's a movement.
People take time out of their very, very busy school and work schedules to come together and strategize as one network. It's very difficult when we see the structures and challenges that we're up against, but knowing that when you're working alongside others who equally feel passionate about the work that you're doing, it fuels us, it sustains us, and that's what gives me hope. So advocacy is an essential tactic in that anyone can do it. Anyone is entitled to speak openly and proudly about the things that they believe in, but it's important that that energy is directed to the people who have the ability to influence those systems, those practices, those resources that will make health possible.